Hello, everyone, and welcome to today's Physical Activity Alliance Professional Development webinar titled Framing Equity in Physical Activity for a talk with public health leaders in physical activity as they collaborate and share important framing approaches to communicating equity in physical activity and give an overview of their professional observations of the report, including principles, processes, problems, and proposals in the new report entitled the Framing Guidance Equitable Physical Activity. I'm Nicole Keith, professor of kinesiology and second past president of the American College of Sports Medicine and a member of the National Physical Activity Plan Executive Committee. I'm honored to serve as the host today on behalf of the Physical Activity Alliance. This webinar is being recorded and can be found later this week on the Physical Activity Alliance YouTube channel, as well as on the PAA website, which is paamovewithus.org. Send questions at any time during the discussion to the Q&A box. We will address them at the end, after all four presenters have shared their evidence-based knowledge, as well as their experiences with us. In this order, our presenters are Fiona Bull. As the head of Unit Physical Activity at the World Health Organization based in Geneva, Switzerland, Fiona Bull leads the global work on physical activity, healthy eating, and the prevention of obesity. Next, we will hear from Katrina Piercy. Katrina Piercy serves as the Director, Division of Prevention Sciences, U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion. She is also a commissioned corporal of the U.S. Public Health Service. Next, we will hear from Ken Rose. Ken Rose is the Chief for the United States Centers for Disease Control and Prevention's Physical Activity and Health Branch, which oversees national efforts to increase physical activity. And finally, we will hear from Julie Sweetland, who is a sociologist and serves as a senior advisor at the Frameworks Institute, where she leads efforts to diffuse the organization's cutting-edge evidence-based reframing recommendations throughout the nonprofit sector. And so without further ado, I will turn it over to our first speaker, Fiona Bull.
Well, thank you very much, Nicole, and thank you very much to the organizers of this event. And it's a great pleasure to join you from WHO headquarters here in Geneva for this session and for the discussion and panel commentary on the report and on this important issue. I'm delighted to have been invited to get things started and to provide some opening remarks from the perspective of WHO and our global agenda. And setting the scene, we're all here because we are passionate and focused on in our professional work, and I'm sure even in our private and family life, on the importance of physical activity and being active for health. And yet the world faces considerable inequities in the opportunities to be active, and that's shown in the levels of participation as we track them at the country level and at the global level. I'd like to limit my contribution to starting this panel to about 4 areas. So let me go through those. Firstly, let me remind you of the global guidelines on physical activity and sedentary behavior, and building very much on countries like the US, Canada, and a few others that have led in establishing and updating regularly guidelines on the merits and benefits of physical activity. The global guidelines provide this tool to the global community, to countries that can't afford or haven't got the scientific contributions to keep updating guidelines. But both the US guidelines and the global guidelines speak very clearly to the benefits of physical activity to all people of all ages and all abilities. Now, I'm just going to check in with Nicole that the audio is coming through clearly, given some comments in the chat box, but you're nodding, Nicole, so I'll carry on with no interruption. Thank you. So we have the framework. The science is very strong. It's across multiple health outcomes of both physical and mental health, and it's good for everyone. So my second point is to look and remind you of some of the global data. The global data show that about 27% on average do not meet the minimum guidelines. We know more is better, but we want as many people as possible to reach what we call that optimal amount. For adults, 150 minutes a week, for children on average 60 minutes a day. But it's when you look at it broken down, disaggregated, it's revealing. And it reveals across different parameters of inequity. Let's start with gender. And this is clear, persistent, and across countries. The majority, and I'm talking all but a few handful of a few countries, have got a gender difference, and the direction is that men are more active than women. Or framed another way, women are less likely to be achieving the recommended physical activity for their health benefits. That's not right. But we can break it down and disaggregate by other parameters, the ones which we all use and know of. However, they're often captured in instruments and surveys in a different way. But let's take age. That's one which tends to be the same, although categories vary. And we do see, again, the differences as people are less active as they get old. I say they are less active, but let's actually neutralize it. People of older years are not meeting the recommendations. And the big question that begs is why? It's not always by choice. In fact, that is the issue we're going to get to in this meeting. But I want to comment before moving on to my third point about other disaggregated data, because country data, and I believe panelists will share from the US and we know from elsewhere, when we look at physical activity levels by ethnicity and race, when we look at it by income, when we look at it by education, we can see the differences. And so we have to keep asking the question, why? It's interesting that over the last decade or two, we've been presenting these data, but now I think it's very welcomed that not only at the global level, but by way of this panel and this report, we actually have to bring that to the front of the conversation. It is unfair. And we have to ask, why is this systematic differences still seen in so many countries and so many communities? Before I move on, I want to make the last comment about disaggregated data, and that is to talk about people with disabilities, because again, there are disparities. However, globally, the data are non-existent. We do not have a global database of levels of physical activity with people living with disability. That's not right. First of all, we do need to collect data, and we need to learn from countries collecting data. Where the data exists, we know they're less likely to be active to the health benefits. So, put short, WHO tracks levels of physical activity and shines the light on the inequities that we can see in levels of physical activity. But I want to turn to my third point, and that is about the inequities in policy implementation. Because when you think about why, and as we all know, the causes, the determinants, the barriers, and the enablers to being active, the causes of the inequity lie in the unequal and unfair implementation of policies that will provide the environments, that will provide the opportunities, that will provide the social and cultural environment that enables everyone to be active. Now, the data here are less available, but I'm very pleased to forecast to the audience that we are looking at this policy implementation and the differences and levels of policy implementation guided by the Global Action Plan on Physical Activity that you know WHO launched in 2018, setting an agenda for the 12 years to 2030. We are 1/3 of the way through those years, and we will, in October 19th, just a month and a half away, we will be launching the first global status report on physical activity policy implementation. Now, I can't reveal all the data tonight, I'm afraid, but let me give you a hint. A hint is that it's going to show very uneven implementation of the majority of policies. And the unevenness follows the pattern of those with more resources are more likely to implement the policy. Countries and communities with less resources are less likely to implement those. And so now we can start to see both the prevalence data and the policy implementation. And both of them will point to the more is needed to promote physical activity, more communication and advocacy is needed to all of the stakeholders to address the unfair and uneven distribution of participation and policy implementation. And the two are clearly connected. We brought this to the fore last year because COVID, over the last 2.5, 3 years, has shown us many of the points that I think we're going to hear today. And I'm sure panelists will also speak to the impact of COVID. But it's been unfair in who has had opportunities to use digital resources while places were shut. It's been unfair that some of the streets and walking and cycling facilities are better in some places than others. It's been unfair and uneven in the response from cities, countries to supporting people to be active. And we've got a lot to do for everyone, children and adults, to catch up and then address the inequities that I spoke about, inequities we could see before COVID. If you're interested in our document, it is called Fair Play, and it was published on our website, and I'd be happy to put that in the chat box when I hand over the floor. But it's a short advocacy tool, and it's just one of the mechanisms that WHO is adding to showing the data and now showing some and calling governments, communities, that we have to put the spotlight on the differences. I'll finish, Nicole, by just reminding the audience, the Global Action Plan set a target to reduce physical inactivity, I rather say it the positive, to increase physical activity participation by 15% by 2030. But it has an important second goal, and I'm sure readers and participants of this panel would be interested to know. It calls explicitly for narrowing the gap and reducing inequalities. So we are working with countries not only to raise everyone's levels of physical activity, but to reduce those gaps I opened with, whether that's by age, by gender, by ethnicity, by income, or by race. I want to congratulate all the authors and the organizations involved in these publications, the first one on communication and this one we're celebrating and talking about today, because doing better at communicating about what physical activities and what we need to do is absolutely vital. So I'm really looking forward to what other panelists have to say, and I'd like to thank the organizers again for inviting WHO to participate. I hand back the floor. Thank you, Nicole.
Thank you, Dr. Bull. And so without further ado, I would invite Dr. Piercy to turn on her camera and get started.
Thank you, Nicole. Let me just pull things up. All right. First, thanks to the Physical Activity Alliance for the invitation to present on today's webinar, and to Fiona for really setting the stage about physical activity data, what we know, what we don't know, and where we need to fill in some of those gaps. I want to share with you all some background on how we developed the messages for Move Your Way, which is the federal communications campaign for the physical activity guidelines for Americans. So to understand how Move Your Way came to be, it helps to start at the beginning with the science. The product of the Dietary Guidelines or Physical Activity Guidelines Advisory Committee is a detailed scientific report. The federal government then takes their summary of the science, translates that into the policy, the Dietary Guidelines or the Physical Activity Guidelines, which are written for health professionals and policymakers. If you read the guidelines, they're quite technical and not written at the consumer level. And that's where My Plate and Move Your Way comes in. These resources are designed to take the science and put it into information that everyone can understand and use, no matter their age, abilities, health status, or fitness level. These communications campaigns focus on the small changes and the actionable steps to help guide behavior change. Now, while we have very clear and strong evidence about the benefits of physical activity, as Fiona just spoke about, the awareness of the guidelines, knowledge of what the guidelines are, and levels of people actually meeting the guidelines are quite low. And we also know that there's disparities when it comes to participation. So this is a good opportunity that while we'd like everyone to meet the guidelines, for adults that at least 150 minutes of aerobic activity and 2 days a week of strength training, something is better than nothing. We know that even with small amounts of activity, there can be immediate benefits. So this is a good reminder that most of you are off camera watching this webinar, which means you could be spending the next 45 minutes to get in some physical activity. How about a plank or some push-ups? You could be walking in place. It all counts and it all adds up. So the low levels of awareness, knowledge, and meeting recommendations is what led HHS to create Move Your Way. The Move Your Way campaign is the federal voice for communicating about physical activity, and we launched this along the second edition of the guidelines in 2018. The goal with Move Your Way is to raise awareness, increase knowledge, build self-efficacy, and shift behavior. When developing Move Your Way, HHS knew that we wanted to reach a very broad audience, but that some segmentation was needed. We divided our audience based on the demographic groups covered in the guidelines itself. So in 2018, we launched with 50 resources in English and Spanish, focused on information for youth, adults, parents, older adults, and healthcare providers. We then began to expand the campaign and added new audiences, people during and after pregnancy and teens, and additional materials for existing audiences. Now the campaign includes over 80 free resources, ranging from fact sheets and posters to videos and interactive tools. And moving forward, HHS will continue to support the campaign through new audiences and tailored materials. We certainly know we haven't reached everyone. Campaign development started 2 years prior to the release with a rigorous process to ensure the science was translated into messages that would resonate with various audiences. Since inception, HHS has conducted over 30 campaign research activities to inform Move Your Way development, expansion, and implementation. We use a combination of online surveys, focus groups, in-depth interviews, and usability testing sessions to gather information about the knowledge, attitudes, beliefs, and information needs that help inform the communication preferences of our intended audiences. We test not only the messages, but the images used on each resource to ensure they reflect the diversity of what individuals in our country look like in different settings and in different bodies. We also gather feedback and reactions to campaign materials before and after launch so that we can continually improve. Throughout all of these research activities, we take steps to ensure that we're gathering data from a diverse group of people, including a range of education, income, health literacy levels, racial and ethnic backgrounds, and geographic areas. Here's one example from our research and why we specifically use the term physical activity and not exercise when we talk about Move Your Way and in the guidelines themselves. Our findings are very similar to those in the 2020 frameworks reports and even early research that suggests that the public has a narrow understanding of what physical activity is and tends to adopt a no pain, no gain perspective. The public also thinks that physical activity mostly happens in dedicated workout spaces. For many people who are not meeting the recommendations, as Fiona spoke about, we're talking about at least 2/3 of adults. These interpretations of physical activity can be especially overwhelming and even prevent them from taking small steps to get more active. The 2020 frameworks reports also include a recommendation to broaden the public's understanding of all the ways that people can be physically active. And that's exactly what we do with Move Your Way. We're trying to change the conversation. Move Your Way means lots of things count as physical activity, even everyday tasks like cleaning your house. You could be doing that now while you're listening to this or walking your dog. It all adds up. Even a few moments of moving more each day can have some real benefits. And finding activities that work for you, so it's easier to stick with them. This puts a focus on inclusive physical activity, that is encouraging physical activity that works for every person, in every body, in every family or community, hence Move Your Way. After developing the campaign, we tested in 11 communities across the country. These were all areas with low levels of physical activity, but represented a variety of geographic areas, community size from urban, suburban, and rural, and types of lead organization like Parks and Rec, local health departments, and nonprofit organizations. These communities' experiences helped inform a Move Your Way community playbook with tips and materials to help communities of any size, location, or budget promote physical activity. As you can tell, we spent the last 6 years identifying and disseminating physical activity messages which build the awareness and knowledge to help Americans of all ages and abilities be more physically active. We have a lot more information online, and I'd encourage you to use and download the materials, which are all freely available. I'll also share my contact information on the next slide, and I'm looking forward to the discussion part of today's webinar.
Thank you, Katrina. I would now invite, I don't see him anymore. Hopefully he's still, there you are, Ken. There you are, Ken Rose. I would invite Ken Rose to share his slide and begin his talk. Thank you.
And we're almost there, hopefully. Can you see my slides now? Awesome, thank you so much. First, I just really want to say that I'm honored to be here today. I think this is an amazing panel to be part of. I want to thank Fiona for her global leadership and thank Katrina for her leadership in Move Your Way. Move Your Way has been really an important way to communicate about the benefits of physical activity, to provide people strategies for learning how to be more active. And in fact, I used many of those materials to help me encourage my adolescent 16-year-old boy to become more active. So thank you for those resources, Katrina. Today I am going to briefly talk about Active People, Healthy Nation, our work at CDC, as well as the field broadly to create an active America together. So physical activity is a great news story. When I first came to the physical activity world at CDC after working in other parts of CDC for 15 years, it surprised me that given the public health impact of physical activity, it wasn't a more universally accepted public policy priority. And so what is Active People, Healthy Nation? It's a national partner movement to get 27 million Americans more physically active by 2027. It engages partners at all levels to implement scientifically credible strategies to increase physical activity. It also helps to support the National Physical Activity Plan's recommendation for a more concentrated focus on physical activity at CDC. And I just want to note that the report that's being released today defines, equitable access and inclusion to physical activity as every child and adult should have the opportunity to be physically active in everyday life, regardless of where they live, their current activity level, age, gender, race, ethnicity, ability, or income. You can see on the slide that these 7 strategies that we promote have a foundation of equitable and inclusive access. And this is important because there are a range of inequities associated with physical activity in the United States as well. And this is also in the report, but I'm going to highlight them because I think they're important. Among adults, people who are Black, Hispanic, or Indigenous are less likely to be physically active than people outside of work, I should say, than people who are white or Asian. By ability, among adults who have a mobility disability, less than half report engaging in regular aerobic physical activity. There are disparities by region. Adults in the US South are less likely to be physically active. Disparities by income. Physical activity is more outside of work, is more generally practiced at higher income levels. The same is common with education level. Physical activity is more practiced outside of work at higher education levels. At age, you see higher levels of physical inactivity or lower levels of physical activity in adults ages 65 and older. And by sex and gender, males tend to be more physically active than females across the lifespan, starting as young as preschool. So I just wanted to highlight that. So, but I also want to note with Active People, Healthy Nation, we have an effort to work with a range of sectors. And you can see on this slide all of the different sectors that can help us promote physical activity. And this is consistent with the National Physical Activity Plan as well. Here, I'm just showing the range of partners that CDC works with in the field to help improve access to physical activity. You can see this through 3 different cooperative agreements and that we support in a wide variety of ways at the state level through community organizations, the Racial, Ethnic, and Communities Health Program, as well as working through land-grant universities in rural areas. I also want to note that we fund a range of partners in the academic world as well as the not-for-profit world at the national level. You can see here the Physical Activity Policy Research and Evaluation Network, as well as the Physical Activity Alliance and a range of other national partners. So what we do fund in the field is a focus on what we call activity-friendly routes to everyday destinations. And that doesn't roll off the tongue for a lot of people. And I want to note that this is important vis-a-vis this report, because what it does really is it helps us think about, and this just shows you kind of what we're funding at the jurisdiction level, trying to create land use and transportation systems that are promoting physical activity, as well as everyday sort of destinations where we've got transportation and land use design that supports those. But I want to note here that the frameworks report is really important to inform our ongoing efforts in this area, because it helps us change the narrative with policymakers to improve these conditions that support physical activity in our communities for all races, ages, and abilities. Using the justice and fairness frame, it says all people, no matter where they live, should have the option to walk, roll, or bike for short trips to essential destinations like stores, schools, and public transit stops. And everyone should feel safe doing so. And I really think that's an important component of this release today, is it helps us think about how we can frame our messages in the justice and fairness, with the justice and fairness theme. So finally, I'll just share a shameless plug to join Active People, Healthy Nation. We cannot create an active America together without support from leaders like yourselves. So if you haven't joined, please scan this QR code. We are extremely grateful for the work that you do every day to promote physical activity in this country. And we hope that you will join us in our work with Active People. And with that, I will conclude my remarks and stop sharing my screen.
Thank you so much, Ken, for this information. We see questions coming into the chat. We also received a tremendous number of questions prior to the webinar, and for that, we thank you. Our last speaker is Julie Rose, and she just moved, or Julie Sweetland, I'm sorry, and she just moved around for me too. There you are, Julie. Without further ado, go ahead and please begin your talk.
Thanks, Nicole. And thanks everyone for joining today. And thank you, Physical Activity Alliance, for pulling this together and for supporting this work and giving us an opportunity to contribute to the thinking of people that are making America a fairer place to move and stay healthy. I am going to speak a little bit, back up just a little bit, and let everyone on this session know that the report we're sharing today builds on some previous resources that have already been shared. So in 2020, with support from this group, we conducted original social science research looking at what the big ideas the field wanted to communicate about framing physical activity in general, and went out and conducted original in-depth individual interviews and cognitive analysis to find out how the public thinks about those very same ideas. Later that year, we looked at what the field was saying about physical activity and how the media was covering it. And that led to additional recommendations for what needs to happen in terms of framing the issues so that Americans are more knowledgeable, more aware, and more supportive of the policy level and structural level changes that need to happen. And so what we're sharing today is a third piece where we looked at both the research on physical activity that we had conducted and other research that we've conducted with other partners on framing health equity topics. And so this is a shorter piece, but it's really honed in on the idea that if we want people to understand the equity dimensions of physical activity, what framing shifts do we as communicators need to make? So I'm going to go through and just pull out a couple insights from those first two reports because they provide the context for the information and the ideas that we're focusing on today. So as we mapped the gaps between the way the field thinks about physical activity and the way the public thinks, we found in some ways this topic is kind of easy to communicate, and because there's lots of opportunities, there's lots of positive and accurate associations that we can build on. So the public knows that physical activity has health benefits. So that's something that has gotten across, and we can build on that. People in general are also able to see physical activity as potentially enjoyable. So that is, again, a place where we can lean into that. And people do have some ways that they're top of mind, widely shared ways of thinking about physical activity is not completely an individual choice or strictly an individual behavioral matter, but can see some context, some social context around that. And that's really important, particularly when we're starting to get into equity issues. So we heard in our interviews that people say, yes, I know, that we should be exercising. We don't want to use that language in messaging, but that's how people talk about it. And I actually like it. I feel better when I'm doing it, but it's just so hard with the work, the kids, the long hours, the commutes, all that sort of thing. So the constraints of modern life are seen as constraints. And people do recognize another social aspect of it, which is that interpersonal connections, the social context, your what your work does, your group, your faith group, your friend group. If they're active folks, you're more likely to engage in that, and so people have that sense too. So those are a lot of conceptual building blocks that we can build on. But we also saw lots of challenges that the field needs to frame their way through to get public understanding in a place where it can support good public policy. So those challenges, among them, this is again a quick summary. The public has a narrow understanding of physical activity as vigorous exercise. And we heard Dr. Piercy, point that out, that there's a sense that it takes place in dedicated workout spaces, and that's what you're supposed to be doing. And so the Move Your Way campaign that really talks about all the different ways we do that is building on that and starting to build that new way of modeling it, but there's more to do. People also tend to assume that when it comes down to it, a person's own discipline and willpower and inner drive shapes whether they are physically active or not. Are you dedicated enough to get to that dedicated workout space? And people do model it as, discrete activity. And we did not see the public really have a robust understanding of how people's socioeconomic status can limit their opportunities to be physically active. So there's a real, there's just not the connective tissue between the idea that if you have a little less income, you are less active. And, there's a sense of maybe those folks have less value on it or are less dedicated, or maybe they just have so many constraints on modern life, they can't get to it. But there isn't a sense that the neighborhoods, right, the neighborhood design, the perceived safety, right, the busyness, right, in the areas, all those sorts of things are not understood. So that's where the public starts. We've got some work to do. We looked at how both the media was covering physical activity and how advocates like the folks on this call were talking about it. And we made some recommendations after reviewing, many dozens and hundreds of pieces of communications. And that's that the field really needs to broaden the public's understanding of all the ways that people can be physically active. That will involve continuing to talk about the way the built environment can enable and promote physical activity. Emphasize the benefits of physical activity beyond physical health, so the social and emotional mental wellness benefits of that. And our final recommendation coming out of that report was to highlight disparities in levels of physical activity and, crucially, explain why they exist. If we only put a picture out that says groups X, Y, and Z are less active and groups X, Y, and Z are stigmatized, marginalized, minoritized, then we may be unintentionally reinforcing negative stereotypes, stigma, and blame against those groups. So yes, shine a light on it, but shine a structural light on it. And that's really important. So that brings us to the recommendations that we are really pleased to share today, because I think they will help a lot of you work through some of the challenges that you've got in how to talk about these things in ways that lead to more equitable policies and, I hope, equitable outcomes. So to center equity, the field needs to reframe, and here's a quick list of some of the ideas we're putting forward. First, instead of, as we've already talked about, it's really important, instead of talking about physical activity as a special activity to build into your day, to move into this story of this is everyday movement that's built into our environment. That's what we're trying to promote. That goes along with, this isn't just a personal lifestyle choice, to start to talk about access to physical activity as a matter of fairness and justice, as Ken modeled so beautifully just a few minutes ago. In the images, we focus a lot on language, but the images that we use, we are in an asymmetrical image fight, I guess. We've got the wellness industry that has, a certain image and visuals they put out about who exercises, what do those body types look like. And we need to supplement that, expand the mental model of who we're talking about, who has access to and physical activity and who doesn't, by showing images of diverse body types in motion. It's easy to just tap into what people believe, that everyone these days, everyone is time poor, and that is constraining the opportunity for physical activity. But if we meet people where we are, we leave them stuck where they are. What we can do is build on that idea that they know it's hard, but channel that attention into structural issues, policy level issues. And so our analysis is that focusing on how housing, transportation options, and perceived or actual levels of community safety, how those three things affect physical activity. Similarly, instead of using our own insider baseball language that just says this is about social determinants of health, that phrase is universally misunderstood and disliked outside of the public health field. But if we give people examples of some of those social determinants of health, people start to get it and they can go along on that journey with us. So again, similar recommendation, focus people on how housing, transportation, and safety affect access and opportunities for physical activity. All of this will require doing a little less description, simply saying this is associated with this, full stop, and instead getting into explanation. What affects what to what end? How do those dominoes connect? How is it that housing affects physical activity, right? Give a sense of that. And that example of talking about, every neighborhood, everybody should have be able to walk, roll, or bike to the places they need to get to every day, right? That is explaining how built environment is connected to everyday motion, versus just saying people in rural areas have less access to active transport options, right? That's a little too descriptive. And finally, often when we are communicating about issues, equity issues, that comes from and should come from a place of real passion, concern for the groups we're pointing out are not being treated fairly or justly. And that can sometimes lead us to amplify the scope of the problem in the hope that we kind of shock or shame people into doing something about it. Oh my God, this is not okay. What that does, and might make us feel better, but it often leads the public to think the problem is too big to be solved. They get a sense of apathy or overwhelm and turn away, or they think, oh, that's huge. Let me just take care of me and mine. Let me cocoon myself and make sure my people are getting enough activity, but don't engage in it at a policy level, at a civic level. And so I'm not suggesting we don't talk about the problem. I am saying we need to calibrate our level of talking about the problem with the level of solution talk and efficacy talk. So saying, here's a serious social problem, but one we can solve, and here's how. So it's a long way of saying, keep solutions in the picture. That's all I've got to say at this moment, but I am excited for the conversation to follow, and absolutely excited to be joining the movement you all have in progress and contributing the perspective of the social science of framing. Thanks, Nicole.
Thank you, Dr. Sweetland. I'd invite all of our panelists to come back. I will start with questions that we received earlier before the start of the webinar, reminding us that we have just 17 minutes to field many questions. And so I'm going to actually start with Dr. Bull, gets to go first, to talk about physical activity and equity. And there is a question about, what does equity have to do with physical activity in general? What is the connection?
Well, I wonder whether the last 40 minutes has perhaps answered that, to be honest with you. I think we're quite clearly pointing to that equity can be understood as having equal opportunities. That doesn't mean it's the same opportunities, but there is not a systematic unfairness to what is being delivered or provided. And it results in inequity of people's opportunities to be active. So I can walk out of my house and I have a cycle lane and a path. In Africa, to take one example, the provisions of separated pedestrian walkways, let alone separated cycle lanes, is not standard. And so we have the situation, we have higher deaths of pedestrians and cyclists on the roads. For one example, but I do think that perhaps the last 40 minutes has given a very good sense of what equity is there, its center. And I think the whole field needs to move from perhaps a focus on just everyone, which means we're not making the disproportionate effort to reach those and support those that need it most, because they will not get the same benefit if we just do average of everything. So it's asking us as the policymakers, as the program providers, to put to one side the easy and start doing the hard to reach those tackle those systemic changes.
Yeah, I loved your comments about fairness during your presentation, and that maybe not all policymakers are interested in talking about equity, but most people are interested in fairness to their constituents. And to be fair, if you give everybody the same thing, there's this assumption that they started in the same place. And so based on your comments, you cannot do that and expect to achieve equity. So thank you for that. Dr. Sweetland, your questions I'm going to give to you are about framing, since you're with the Frameworks Institute, and communication in terms of physical activity and equity. What is the best way for both county and state health departments to do that?
So I think county and state health departments can think about first, two roles of communications. One is that they're putting out health behavior communications. They're ensuring that the people who live in their jurisdiction know that 150 minutes of physical activity is the goal, and those sorts of things, and that here are ways that you can achieve that through everyday motion. It's equally, if not more important, to not just do health behavior communications, but health policy communications, helping people. And I know you can't advocate for a policy, but you can absolutely set up the public to understand this as a public issue that demands a public response. And I think that the strategies that we've offered today are very focused on that. So it's not just helping people know how to take care of themselves, it's helping us all know what we need to do to take care of us collectively. In terms of what to put in those communications, I hope the report has offered some handy tips there, and I'd be happy to take a follow-up question if not.
And sure, I would recommend that if our audience has not had the opportunity to read the report, it is an easy read, lots of great information and excellent messaging that they are free to use. And speaking of excellent messaging, Ken, I'm going to give this next question to you. And it's asking, what are ways to support health departments? So for those of us who are either in academia, in healthcare, or in public health, how do we support a federally funded health departments in furthering the work, the excellent work that places like the CDC are doing?
Well, I mean, I think the first thing I would say is that, unfortunately, at this point, we only have, sufficient funding to support, I think, 16 state health departments at this point in time. And for those of you who have been involved in this work for some period of time, when it's related to our, local work or other work, we don't even have the funding to fund big city or any local health departments really, except through REACH at this point. So part of the issue that we have is, I think that we need to establish a national policy priority for physical activity. I know that physical activity is one of the pillars for the White House conference at the end of this month. And I know that this current White House certainly recognizes the importance of investing in physical activity, including supporting health departments. So I think that's one way, but other ways are depending on what your skill sets are, bringing those skill sets to those departments. And whether in academia, for example, I know that we have had several of our partners work with local health departments and other local organizations to help think about evaluation and more specifically implementation through implementation science. And are we implementing something that will work? And so I think that's one answer I will provide just off the top of my head. In terms of the local advocate or the local policy person leader, and so those have many different hats. Really partnering with your health departments to carry the message that they cannot carry with the decision makers that make these decisions at the local level. So really reviewing this report and carrying that message to whichever level of decision making you need to go to, so that you're speaking in a language that will resonate with policymakers. And I think this report does a good job of providing those advocates with those messages.
And so, Ken, to be clear, because of your employment status, you cannot be a lobbyist. Is that what I'm hearing you say?
I cannot lobby any legislative body or anyone for that matter. And a lot of local health departments also, or state health departments, have the same barriers. They cannot lobby their legislatures or their other decision-making bodies. So that's where I think a lot of the academic and community leaders come in. And that's where a lot of this messaging, I think, can really help move the needle when they carry those messages to whatever body they need to carry them to.
That's extremely helpful, because for us non-official government employees, we might not understand that. And so it's really important to hear that. Dr. Piercy, you did a wonderful job of describing new resources. And we have a question about how to best know that these resources exist and how to understand and use them effectively to, again, offer support not just to our communities, but to our agencies in order to make effective change.
So there's a few different ways to answer that. I will say Move Your Way is quite broad. Kate Olskamp is on with me, and she's actually been the lead for the last several years on Move Your Way. And we've disseminated this information in a variety of ways. But this really started years before we got to the second edition of the guidelines. And there was a lot of interest that we were hearing on the federal side, but also from stakeholders, is that we need something more than just the guidelines. And we know when we test the 150-minute message, for example, that number is big. And it doesn't resonate with people, and trying to do the math over 7 days, it's complicated. And so we knew it was really important that we would need to distill that down. And we've done that in a few different ways with different resources that are targeted to different audiences. We've also done a lot of great work in some pilot sites across the United States to test this out in different communities. So Move Your Way was really set up as kind of a suite of resources that could be picked up by a local health department or by other leaders kind of at communities to take these resources and disseminate them. We know that many health departments, especially the last few years, have been pulled in 18 different directions, and physical activity may be a part of the portfolio. The slice and how much staff or how much funding might be dedicated to that probably has narrowed in the last few years. And so part of why, as the federal government, we are putting this out, same as what Ken has with Active People Healthy Nation, and these resources are out there to use. We're also around for technical assistance, or if you want more information on how we've shared this information or kind of success stories, what's working, what's not. But we're continually modifying and adjusting things and trying to look at what are the audiences. We certainly haven't covered everybody in the guidelines, but trying to ensure that we're putting out resources that would resonate with various populations. And that's why there's such a rigorous testing process before we get out the door. I know Kate's dropped some things in the chat, and anyone's feel free to reach out for more specific input.
Thank you. And you actually also answered our first anonymous question within your answer, so I appreciate that. I would offer this question to anyone. All of our panelists talked about this can't just be an individual choice, that people don't choose to be active or not active. And we have a question from Troy Hearn about that. I think you can all see it. And really, could you speak to his question that why do Americans choose not to be physically active? My opinion is it's not always a choice, and I've heard all of you say that. So I'm going to go back and start with Katrina and then go through all the speakers. If you could just give me a brief answer to that question.
Sure. So one of the things when we started developing Move Your Way, we did a lot of conversations, a lot of focus groups to figure out what the barriers were. The top two from our research is that people feel too tired or too busy. And so we use kind of those barriers. And then also how do you feel when you're doing physical activity? What are the facilitators? And trying to understand kind of both of those sides and then tailoring the messaging. So things like, if you're too busy, how about, can you fit in 5 minutes here? Can you run around with your kid at the playground? Can you walking the dog? That counts. Like kind of really honing in on things you may already be doing and activities that may come into your life already, from commuting to walk to the mailbox, and kind of encourage more of those versus saying that you need to find a dedicated block of time to put on the right clothes and go to a gym. We know that doesn't work. So how do we think about physical activity that fits into your day instead of being kind of a chore of having to come in, because that people are busy, and that type of messaging doesn't work, and it kind of undermines people that are saying, I don't have that block of time.
Thank you. Ken, we'll go to you next.
Thanks. So in addition to what Katrina said, because we certainly hear this, we see the same things in research, and I think the other thing that we also try to address through Active People Healthy Nation, and is a really fundamental component of the Routes to Destination recommendation, is safety. Primarily, over time, we've heard a lot about traffic safety, and a lot of what our work with Routes to Destinations focuses on traffic safety, but I also want to highlight personal safety. And we've heard both concerns about personal safety from crime, but also personal safety, as Dr. Melissa Glover reported in when we actually released Active People Healthy Nation, of having 911 called on you while you're jogging. So, those are real barriers that we have to think about and address, and they're not easy barriers to overcome, but we're working on them.
Okay. And Fiona, what would be your response to that question? You're on mute.
Yeah, thank you. Now, there are many questions. Just remind me which one you'd like me to answer versus
Sure.
I've been reading in the chat box.
Sure. The particular question is from Troy Hearn, and he wants to know why Americans choose not to be physically active. He has lots of data and resources for the benefits and strategies, but not for the reasons why. And so I'm just asking your opinion about that.
Yeah, I think the point that the comment or the question has raised is about our need to continually improve our understanding and update our understanding of why people are and are not active. I can't answer the specific example that you're giving because we need to find out. And we need to ask the people, and it may not be the obvious. You're indicating there may be, for example, some appropriate facilities or accessible facilities, but it's not being used. So there could be other inhibitions, barriers that you can't see, and we won't know until we ask and talk to the communities to find out what they are. And this globally is also raised by countries that haven't got the rich data that, for example, the US has on historical patterns and the causes of physical inactivity. And I think it was asked earlier by a comment in the chat about having more recent data on the US. Historically, these surveys used to be done, and we've spent a lot of time talking about just measuring the physical activity, but actually asking people through different surveys, and indeed not just surveys, to understand why and how important that is, because the communication toolkits speak to understand the audience, understand what you're trying to. They may just not like it. They may be fearful. They may have other barriers and inhibitions that need to be understood and respected, because they're the reasons why you're looking at them and saying, why don't they choose to be active? So I do concur with you, Nicole. It's not a choice for everyone. And it's judgmental to presume that it is, but it's a good question that we need to continually update and improve our knowledge for all the different groups of individuals. Why are people motivated, enabled, encouraged and supported to be active, and what is not helping and enabling? And they're the big questions we need to address in our communications. Thank you.
Thank you. And I suspect over time those answers will change, and so that we will have to continue to ask these questions. So very important. We are almost at the top of the hour. Julie, on behalf of Frameworks, do you have a last word?
Oh, I think with just less than a minute, I might go with frame on, but just the idea that none of our communications are unframed. Whenever we are talking about a social issue, we are either unintentionally activating unproductive ways of thinking about it or strategically choosing more productive ways of thinking about it. And so I just want to encourage everyone who cares about this issue, take advantage of the research base, not only on why disparities exist and where they are, but how we can change our communications to advance, again, a more equitable public response. And with that, frame on.
Beautiful. I want to thank our panelists. I want to thank Frameworks. I want to thank the Physical Activity Alliance for hosting this webinar. It is recorded, and if you want a copy of the recording, the information in the chat is there, and also Ayanna McKnight from the Physical Activity Alliance is available to help with accessing resources. Thank you so much for joining.